Welcome to Evening Rounds, a podcast that takes you behind the scenes in medicine. Tonight, we're joined by Purvi Parwani, who was inspired by her father's medical practice in India to pursue her cardiology career in the United States, advancing the field of women's heart health. If you like what you hear tonight, please subscribe. Well, Purvi, thank you for being on our Evening Rounds podcast tonight. We're really excited to have you. We only have a short time, and so we want to dive right in. I know family's important to you. I wanted to hear a little bit about where you came from and what's home to you.
So I'm a small town girl. I was born in a small town, India. My family, they originated in Sindh, Pakistan, which was before partition, part of India. And then after that, both sides of grandparents, they migrated to the nearest part of India, which was Gujarat. So I was born in a small town called Jaitpur, where my father was at that time civil surgeon of the district. And then when I was 15 days old, we moved to this town called Junagadh, where we grew up.
So to me, that India has such a vibrant culture and it's so beautiful and there's so many different elements to it. Tell us a little bit about what it was like to grow up in that culture and some of the things that you did.
Yeah. So you're right. India is overwhelming. India has all these colors and, cultures and dance. So I think growing up, it was like basically soaking a part of all these different cultures and trying to make of what I am today. I'm a creative person. I think that I had that creative seed back in the day. So my parents, surgeon father who always wished me to be a physician, particularly because I wanted to be a physician, he put a focus on 100%, like studies and you got to do this and you cannot focus on anything else. So I literally would participate in all these school competitions and win the trophy and come back and tell them that, I won this dance competition.
Really?
Yeah. So I basically wanted to learn the classic Indian.
I thought you were talking about academic
no for all the
these are
extracurricular. Yeah. So like dancing, painting, like I basically I was so certain when I was a child because all the other kids were going to classic Indian dancing and I loved dancing, me, my sisters, all of us. And my dad is like, no, you gotta study. So I basically would sneak out, participate in all these competitions, go to a choreographer, learn the dance, win the dance, and then come that, hey, by the way,
just on the side, just in mixed with your studies.
Yeah, but as a result, like now I'm so like I do think that there was some power in that focus because I do have a bit of ADHD, and I don't know if he didn't put the focus where I would be. Like I'd probably be confused in life what I wanted to do because, but I think as a result, I am creative, today, but I don't put focus on my hobbies to be like 100% good at that, right? It's just relaxation for me. Like I'm not going to try to be the best because I just want to clean up my mind by doing all of these things. So my painting is like more than art because I just want to take colors and paint whatever I like to paint. Yeah. And whether it comes out good or not, or like I'm learning drums for like last 2 years because I could not learn drums as a child. And Amy Hayton saw me the other day because she came to drop her kid to the drumming school. And I was like, yeah, I am learning too.
Oh, that's awesome.
That's so funny.
Or like dancing in fellowship. Fellowship was so stressful. So I just decided to join the local Bollywood dance club. And then I did like 4 or 5 stage shows. But they're like just great memories. So I don't want to put too much pressure on myself because it's just a hobby. I want to clean up my mind and come back to my daytime job like 100% present.
I love that you're just like dancing and painting on the side though. How beautiful. And calling it cleaning up your mind. I love that thought. Like
I really get lost in it.
No, but see, that's actually amazing because myself included, can get very frustrated with our hobbies.
Yes.
Because we apply what we think we should be, but we're a professional in something else.
Yes.
Right?
Yes.
But you guys feel like you're perfectionists, though.
Yeah, but
you have to put that on side
like,
when you're...
because you have very little free time, right?
Yes.
And if your free time is frustrating,
Yeah.
what are you
Then-
gaining
yeah,
out
exactly.
of it? So that's a beautiful way to look at your hobbies.
Yeah.
So you're a young girl in India with your family in a small village. Sounds beautiful. Now you're in Southern California. I'm just curious about that.
Yeah, no, I mean, I don't think it was a plan growing up. In India, we have fortune tellers. When we, are born, they predict all of your fortune. And it was actually told for my younger sister that she would go abroad, which she is, she's in United States. But not for me. I think I was probably in second grade when I told my father that I would be a cardiothoracic surgeon.
No kidding.
He's a general surgeon, and he was a great inspiration for me. I would follow him around all day long. When he was rounding, when on summer vacations, my uncle is an orthopedic surgeon. And both of these men, they had a special place, in my heart, and they were really inspiring. But I think that I did grow up with this. I still remember what it was. I went to a convent school growing up, and, I topped in a lot of competitions that were regional. It's a district place. It's not exactly a village, but it's a small district place, a population 400,000. So I think anytime I would go to these interstate competitions, I would have this complex of, I wish I was like from Bombay or Delhi. I just, I don't know. I had this complex that I was not enough. Because I was from a small town, I didn't have enough exposure. Maybe I was lacking opportunities. And remember, this is like pre-internet era we are talking. I think it was in med school. I used to organize. So I was a university topper. I used to organize these private tuitions for my med school class. And that meant that we went to these private surgeons, private cardiologists to get extra knowledge so that in the Viva competition that we had for our exams, medical school exam, we could perform better. And at that time, in that private tuition, I met all these kids from other med school while organizing, and they became very good friends with me. And some of them, were rich kids from this town. And here I am from a small town girl. And I still remember that conversation at a coffee shop where we are all sitting. And this kid, Tanmay Swadia, who is actually a cardiologist in US now, he had just come back from United States after doing clerkship. And he's telling us, guys, when they admit patients in US, they actually diagnose the problem before they discharge. And the air in New York, it's so clean. And we're wow. I still remember till date, we go, wow. So I think the initial spark was there that this guy is talking about a place where I can train to the best of my capabilities. See, because of the resource limitation, although my med school, the hospital is attached to, is the biggest hospital in Asia. You can see all pathology, but because it was a government hospital, because of the resource limitation, if a patient with anemia came, we would give them blood transfusion and let them go. And here I am in my books trying to figure out, can this be pernicious anemia? Can this be iron loss anemia? What can we do? What this patient will come outpatient? And I'm trying to put these strings together that, when is this patient going to come outpatient, and how am I going to figure out, because there was that inner diagnostician in me.
So you had a drive as a 7-year-old, 19-year-old, 22-year-old. You still have a drive today, but what's your focus today?
I think right now my focus is, of course, help, improving heart health for our patients, particularly for the women patients. It's, I think there's
but
so
hold
many.
Hold on. So what you're saying is that men and women are different?
Yes, Dr. Hilliard.
You heard it here first, ladies and gentlemen. Evening Rounds podcast. We've cracked the code.
So, men are from Mars, women are from Venus. I think there's that book, right? Yeah. So, but I think it's very, very important, right? Yes. I mean, one of the things we've worked really hard on in the U.S., but still there's huge gaps there, is that men and women are different, right?
Yeah.
So talk to us a bit about your passion regarding trying to promote women's heart health.
Yeah, that's a great question. Again, roots go back to where I grew up. saw aunt die of, heart disease at a young age, like in middle age.
Did you?
And yes. And, like to me, I'm like always like asking my father this difficult question, how did she die? Like, what do you mean? We couldn't do anything? Like, I'm always asking him these difficult questions every time anyone in the family passed away. And, she had rheumatic disorder. And, so there was always this curiosity, but till I think when I went to med school, I'm sure it's the same for you, or in fellowship, there was not that much focus on how physiologically women and men are different. And what I mean by that is, we think that everything that we think of, most of the medical research that was directed, unfortunately, in the clinical trial, most patients were men. Mm-hmm. And we thought that we could take that same body composition, texture, blood flow, and apply everything to women. And that was not true. And we realized only in, early 2000s that, the women were dying more of heart disease. And there was this founding father of NIH, Dr. Bernadine Healy. She was on the path to discover why there were differences. And I think now we know physiology of the heart is fundamentally different between men and women. And to be honest with you, I didn't learn anything about it in my fellowship. And my fellowship program director, if they're listening, they can be upset. But, that's the thing, I actually learned about it mostly by going to conferences. And I thought like, okay, I'm learning about how to be a better diagnostician because I was doing cardiac imaging. And maybe I can combine the two fields. And when I came to Loma Linda, I saw that gap that, okay, here is an area where I could actually expand because there's no one giving these services in the, to the very diverse, ethnically diverse and low socioeconomical population of Inland Empire. So I saw an opportunity and then that led me.
So when you think about this is what's fascinating, Kelsey. Mm-hmm. So more women die of cardiovascular disease than all cancers combined.
Is that really?
So, and the tragedy or the blessing or the curse, however you look at it, is women can have heart disease, come in, be treated, come out, and no one knows they even had the affliction, right?
Why?
Well, because unlike cancer is very painfully obvious for people who are suffering from cancer, right? That not necessarily the cancer itself can cause the human body to look different, but certainly the treatments can as well, right? And so just by definition, there's a lot of awareness. And the cancer path can be very long. That journey of active treatment can be very, very long. Whereas with heart disease, you have this immediate affliction, whatever that is, spontaneous coronary artery dissection, myocardial infarction with plaque rupture, stent placement, whatever. You're in hospital for a short few times, and then you're coming out and having chronic care management. But if you were to look at the person, you wouldn't know they had a problem often.
Yeah.
And so it's an interesting sort of paradigm that more women are dying from this disease process than all cancers combined.
And you have a women's clinic here at Loma Linda specifically for this, to address this issue, right?
Yeah. I think, to add to what just Dr. Hilliard said, that is not to undermine the importance of cancer, but it is very clear that some of this, the problem also stems from society, physicians, right? A lot of, when women go with complaints of chest pain or just not feeling right or shortness of breath or very non-specific symptoms, they are told that there is nothing wrong with them, right? So I think that's where we fall. And, it's just like these implicit biases that we have lived with for years, how to break them and, pay attention. And even if there is nothing wrong with them, giving them a plan that, okay, this is your overall risk of having heart disease in next 10 years, and this is what you can do to improve your chances. But I think the problem is that from emergency room physicians to nurse practitioners to cardiologists, to internal medicine physicians, thinking that anxiety is the first thing somehow associated with female gender.
When women present.
When women present, yes.
Wow. So you said something really interesting there. You said, how can we prevent this? And I feel like you're very big on prevention, specifically, obviously with women, but with all patients that you see. What are some ways that you kind of live that and you also help kind of educate there?
Yeah. I think, as a cardiologist, I think Dr. Hilliard also lives by this. So as a cardiologist, it's very important that what we tell our patients, we actually, do, right? Because
You don't want to be
otherwise,
hypocritical? Or what?
You both really, truly. I could not be sandwiched between two
in
greater.
fact, in our department, when I think
Yeah.
about it, most of us, we do what we tell our patients to do, and I think that has such a big influence, right? I really think, Kelsey, that as a physician, it's a privilege to be in this position, right? To give back to the community, to be that messenger
Yeah.
of promoting health. So to me, a lot of emphasis that I put is on diet, exercise, and also on stress reduction. That kind of somehow
And
is
women know a
forgotten.
thing or two about that.
Absolutely. I always tell my patients that most of the female patients, most of the women, men say that, okay, I did this exercise and I had chest pain, and most of the women will present that I had arguments with my daughter and I felt that pressure. And to me, that's a sign, right? So stress reduction is as important. So for me, I think, where did I read this? I think Robin Sharma, he calls about MVP, right? Meditation, visualization, and practice. So that is kind of the motto that I live with. So meditation is a big part of my, daily routine. 20 minutes being with myself, being silent, reflecting a lot on what the day. And, I tell you, the days that I'm busy and I don't do it, I know I'm going to see a different self in clinic.
Do you?
Yes, absolutely. I think you have to put that intention that I'm going to be a healer for my patients today. I'm going to try my best to give back. And I think that comes from that meditation part. Exercise, of course, is important. And, I think that we just put too much pressure on ourselves when we say that we have to give half an hour on one. I always tell my patients, do 5 minutes 10 times a day, and there you go. That's 50 minutes. So it's like, what are the unconscious efforts, taking stairs in the hospital, parking the car far away, making steps done in between the echo lab rooms, standing up in the echo lab, all the small ways that you can difference. And of course, diet, plant forward, plant-based diet. I'm big on it. You have
What does
seen
that
it on
mean?
my...
Tell the viewers.
I think there is clear data, originating even we have contributed so much. I mean, by me, I mean 7-day Adventist study that, there is less heterogeneity, less inflammation with plant forward diet. And I always meet my patients where they want to meet me. So if they have eaten meat all their life, then I tell them to give a few parts and make it, visualize 3 colors in your plate. So having salads, making sure that you are snacking on something that is healthier, whether it is mixed nuts, whether it is carrots and celeries, whatever it may be, drinking enough water, getting good sleep. So I think all the basic stuff, we all know that it's all about implementing it in our life and, making that change.
Purvi, one of the things I wanted to ask you is you do have a pretty significant presence on social media. And there's a lot of social media stuff out there, right? And so trying to have patients who look at social media and come in and say, well, I read this or I saw this on social media, so I'm going, this is the detox I'm going to do, and I'm going to cure my coronary artery disease, or the chelation therapy I'm going to do, or whatever that is. So my question for you is, what's your advice to patients when they go on to social media, and what's your approach to social media and your own use to spread high quality information regarding healthcare?
Yeah, I think the thing with social media is that we have to have our own narratives. There are so many narratives out there. And as physicians, if we don't have our own narrative, someone is going to write it for you, right? So I have the capability and choice to tell the world what Purvi Parwani is about, and what I preach and, what I believe in. And if I don't do that, someone else is going to be doing that, because that's the world that we live in. I don't think you can control everything. In fact, I don't even try to. I don't argue with, most people in social media. I do my own thing. And I think that should speak volumes. So for my patients, it's a, easy answer. I tell them that a lot of them follow me on my public channel, which is what I want them to do, because I want them to give the right message. And I think apart from that, it's about that connection that you develop with your patient. patient, right? If you're in rush, you go in the room, you don't make eye contact, you don't have connection with that patient, how are they going to believe you?
Yeah.
So I think in that first visit, how are you winning your patient's trust? It's all about trust. So many of my patients have had incredible journey. They have lost, 40, 50 pounds. And to me, that's all about living, as a physician. That's what gives me like the biggest pleasure and joy in my professional life. That's where the gratitude comes from. So I think if you build the trust, some of them come from a low socioeconomical class. They can barely make their ends meet. How are you going to tell them to buy that $10 salad, right? Like you have to meet them where they are. You have to give them tricks. You can't just give a prescription of healthy life and just tell them that they're going to follow. But I think I also tell them to let go. When I know that I have won their trust, I tell them to let go and trust on me for their hard journey. So I had a recent patient who is, he's really obsessed with his low HDL. And he's like, this is making me so anxious.
So hold on. So you got to educate people. So you said low HDL. So what's HDL?
Oh, so HDL is high density lipoprotein. So in other words, that's the good cholesterol. So your bad cholesterol may be low, but if your good cholesterol is low, then it can be a risk factor for heart disease. Now, we used to believe in HDL a lot back in the day. Now the data, may show that that much importance entirely is not needed. But nonetheless, this gentleman, he would get so anxious over this. He sent me so many in-basket messages. And I told him, I told them that, what's killing you every single day more than this low HDL is your anxiety and the stress that you are living with surrounding this. It's the compulsion, the emotion that you have around this thing. If you just let that go, it will make a lot of difference. And it really clicked in. And, we have had some wonderful conversations since then, and he's on a path journey. But I think some of that is exactly that, just like you really have to win the patient's trust to make that impact. And I don't think then social media or whatsoever will matter because they have the trust in you.
Yeah.
You've mentioned your father and your hometown several times. We haven't talked about your mother, but I'm guessing she's had impact in your life as well.
Absolutely. My mother, gosh, I haven't known anyone more happier than my mother. She's just such a, I don't know, just like pure joy, love, or whatever, just like that epitome of sacrifice and love and joy. So I think all of those qualities, being positive, being in the moment, looking forward, forgiveness, just giving the others chance, that all came from my mom. And not that my father didn't have it, but gosh, she till date, anytime I describe any situations to them, the advice that I get from parents, the wisdom that I get, that's the best. And I know it's always going to be right because it's always keeping the other person in mind.
That's so beautiful. I feel like so much of what you just said, I see so reflected in you. But I also see that so reflected in what we do here at Loma Linda.
Absolutely.
Which is that
absolutely.
Is that why you found Loma Linda?
Yes. It's so funny, right? Like it's the serendipity.
Yeah.
I had interviewed, at many places, and I still remember when I came here, I'm a very intuitive person because of the meditation and stuff. I think I can feel the connection. And I did not know what it was. I just heard the voice, this place will take care of you, right? And I was in a bad place in life then, and I was struggling to find a way, like to the point I had thought about moving back to India because I didn't have a path forward. And I still remember, like, as I was driving on the Barton Road, those palm trees, and as I'm approaching the hospital, there was this inner voice. And I'm just so blessed, like the philosophy, what's the inner core of Loma Linda. I so connect with it, even if there are, differences that we see. And like, of course, I think to me, I don't know, we don't give you enough grace, Dr. Hilliard, but I think you have been a bigger part of my journey, and that, how much you have contributed and, yeah, so I think it's very rare to have that, where I think it's so important to have that working environment where you can walk into the office and you can say whatever you want, and because you felt, and then just see what is the other side, And it doesn't mean that, Dr. Hilliard or for that matter, anyone else, they solve all the problems that are at hand.
Yeah.
But I know that I at least get heard. That is so important. And as I talk to more colleagues across the country, I think that is, one of the leadership qualities that everyone should have, right? Like till date, I don't think I always go with the craziest idea to his office that I want to do this. And he's like, sure, let's do it.
Yeah.
And to me, that is, anytime anyone interviews at cardiology department, I tell them this is the strength we have. It's like a family. And I'm not fearful, just like I'm not fearful to tell anything to my brother or to my father. I know that I may be wrong, but that doesn't, I know that I'm not fearful.
Yeah.
Evening Rounds is based on storytelling. And, Dr. Hart, as our institutional leader, has talked about the wonderful stories that Loma Linda has to share. And, we certainly appreciate your time this evening sharing your stories. It's vulnerable, it's a little scary, it's inspiring, all in the same time. We chose Evening Rounds, the name of the podcast, specifically because physicians understand kind of what evening rounds means compared to morning rounds and things like this. So I'd like to hear from your perspective, when you hear the term evening rounds, whether it's in life or in the practice of medicine, what does it mean to you?
No, that's great. I think evening rounds, which I would tell you what is my daily routine here at Loma Linda. You have seen this. I watch sunsets a lot. I'm in my office all the time. I think it's really, introspect. I think this is the time when I kind of unfold. I, write down all the interesting patients that I've seen that day. I actually have an Excel sheet that I maintain on my office computer. I think about the research ideas that may come out of, that interesting patient that I saw, the difficult patient. And more importantly, like what is the positives and negatives throughout the day? What did I learn? What did go wrong? And how do I make myself better the next day? I think it's so funny, Dr. Razzouk, every time I go to OR to do the echo, he introduces me like this to his staff, that she meditates, in that corner near the church, because on my difficult days, I'll go there, around the church, that circle, and I would just walk or like sometimes sit down. And he apparently caught me a couple of times doing that. And he always tells his staff this. But I think that it is so important to introspect and reflect and feel the gratitude. It's a privilege to be a physician. And there are so many things. I think we are people, right? Like basically medicine is all about dealing people, and how do we make our interactions more positive and make impact on other lives. That's my evening round.
Well, Kelsey,
yeah,
it was a pleasure to have Purvi on our
so
Evening
wonderful.
Rounds
Thank
podcast
you.
night.
So much.
Thanks for
thank
being
you.
here. A special thanks to the sponsor of Evening Rounds, La Loma, who has provided banking services to the Loma Linda community since 1955. Their support helps us continue bringing you episodes focused on health, story, and mission.